The latest in the coronavirus emergency, at least 40 states reporting an increase in cases, and the CDC is redefining what close contact means for the spread of the coronavirus. Our chief national correspondent Matt Gutman has the very latest.
You're watching yet another patient being wheeled through one of the nation's busiest ICU wards. Its capacity, 24 beds.
We probably are averaging on any given day somewhere between 28 to 32 ICU patients.
ABC News got a tour at the Billings Clinic Hospital ICU in Montana, where they've converted offices into hospital rooms and started doubling up on patients.
We've held people in the operating room until we could get a room open for their care here. We're taking care of them on the cardiovascular unit.
There are literally COVID patients all over the hospital.
There are COVID patients all over the hospital, yes, correct.
COVID has made a hard landing in so-called flyover country. In North Dakota, just 11% of hospital beds available. Researchers at Children's Hospital of Philadelphia forecasting a continued deteriorating situation throughout the Mountain States and Midwest. That is, if distancing and mask wearing does not improve.
I want to remind everyone, mask up, Illinois.
The governor of Illinois shutting down indoor dining at restaurants and bars in some Chicago suburbs. In Wisconsin today, a new record, 48 deaths, and in Ohio, another record, more than 2,300 cases in a single day. Hospitalizations climbing in 40 states. In Boston, following a surge in the positivity rate, the school district again putting plans on hold to ramp up in-person learning after nearly 6 of every 100 tested persons tested positive.
I don't know what my old schools look like.
But in places like Montana, bars and restaurants were humming Wednesday night. No social distancing. And here in Billings, it's up to Barbara Schneeman to write a press release for each COVID death, though she never knows their names.
Every time I write a press release, I think, oh my gosh, am I going to be writing the press release that says a woman in her 70s, and it's my mother who's passed away.
So the CDC has changed its definition of what close contact means. Previously, it said that if you spent 15 consecutive minutes with someone who had a confirmed coronavirus case, you were at risk. Now they're saying it's 15 cumulative minutes over a 24-hour period, meaning you don't have to just sit next to someone all day in the office. You could just pass them by in the hallway multiple times a day and be at risk, unless, of course, you're wearing a mask. Michael.
All right. Thank you so much for that, Matt.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.